Okay, so this exercise is for big toe extension, and we're going to both look at the passive stretch element to it, where to feel it, how to set it up, and also then the control element, which is using PAILs and rails, progressive angular isometric loading, pushing in one direction to you and I, and then pulling with the regressive tissue, trying to train the other side of that joint. Now I'm going to use this thing. You can use a door frame, you can use a yoga block. If you really have anything really that you can wedge underneath your foot in order to create the amount of big toe extension that you actually need. Okay, if you don't have a lot, then you're not going to be able to use a door frame because it's going to be a bit too aggressive, but you can see and understand once we do that. So I'll set it up here. What I do here is I just push my toe up against, okay, the ball of my foot is down, the heel is down, and the little pad underneath my little toe is also down. Okay, this takes me into a passive stretch for big toe extension, important for running. You can see the angle here. Okay, now you can use whatever wedge you need, whether it's a door frame, the door wedge here. All right. Now, how are we going to set this up? Now, we don't want the foot to pitch and roll too much, so that you're on the outside of your foot. We want a good, strong tripod. 1, 2, and the little pad underneath the little toe. Okay, and to be honest with you, once you can feel the stretch on the underside or the opening side of this joint, that's enough. Okay, you're working some tissue there. If you're having pain on the closing angle, I would stop. All right. So the passive stretch, you can play around with knee angle, etc., should be feeling on the open side, and you would hold that then for the 2 minutes. After you've done that and you've sort of pushed the dial up, told the central nervous system it's safe to be here, we are controlled, we can then talk about PAILs and rails. Progressive angular isometric loading is then to load the stretched tissue here. We take a breath in, we make sure that that tripod is down, and then we try to drive our big toe into whatever object it is. So I'm trying to gas pedal it down into the floor, push it downwards. Okay, that should increase the sensation on the open side, but now we are intentionally loading that rather than passive. You hold for the allotted time, ramping up through your percentages of effort depending on your program, and then after the allotted time we then switch to a rails contraction. Rails is concerned with the regressive tissue, so the stuff on the other side or the closing angle of the joint. As we use all of the stuff on the top of the foot and into the shin in order to try and pull the toe off whatever object it is, we want to be careful that we don't then see any pitching or rolling through the midfoot. So I've pushed in, rails, push, 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 and then driving the ball of my toe down, on the ball of my foot. I'm then trying to use the stuff on the top, this big tendon here, to try and create space between my toe and whatever object. Okay, because you're at your end range, you are not going to be able to do that. All right, but it's all about intention. It's all about using that stuff, training the other side of the joint. After that, you can then go back and then try to take yourself into more passive stretch. The same thing, spend some more time there, and then PAILs and rails again for however many times are in your program.